Is that your laptop or?
Yeah.
Okay. You can delete that part.
It's just going.
Scene survey. Scene safety, no fire, no gas in the glass, no danger to me or my victim. I have one patient. She's good, unconscious, no level of distress. I don't see any angulated fractures or any deadly bleeds or any fluids. The scene is safe, and this time is 11:14. I'm approaching at the feet, seeing if she tracks me. She's not tracking me. She's motionless. I'm going to suspect C-spine, so I'm going to grab C-spine. Assess for level of responsiveness. Hello, hello, wake up, wake up. No response. Because there's no response, I can also do Glasgow coma scale if I like. But there is no response, so you go call EMS. I have an unconscious female rugby player, do you understand? And then please come back. I'm suspecting C-spine, so I'm going to get someone else to come and grab C-spine. No, you don't have to. So put your hands here and here. You have C-spine? Yes. Okay, I'm going to let go. Open the mouth. Look at the mouth, no gum, no mouth guard, no chewing tobacco, no fluids. Look, listen, feel for breathing. I see that I'm just verifying, so she's breathing, and I'm going to check carotid pulse, not radial. Carotid in your primary. Why not radial? Could be a broken arm that hides the pulse. Carotid is there, breathing is there, ABCs are fine. I'm going to do a rapid body scan, also known as a rapid trauma assessment, also known as DCAT, BLSTIC, DRT, which is basically a rapid head to toe. So head, I'm looking for soft tissue, bony, or fluid abnormalities. That's just my little saying. I can call it a bleed and squeeze also. Okay, so looking at the head. Here's eyes, nose for fluid, so blood, CSF, I don't see any. The nose, the cheekbones, the mandible are all fine. I don't find any abnormalities. C-spine, no abnormalities either. Trachea is midline, no jugular vein distension. I don't see a medical alert necklace. Collarbones are fine. I'm gonna check the rib cage. Response to pain, so I don't feel crepitus. There's crepitus, good. And as I'm observing, I don't see asymmetrical movement in the ribs, and I do not see paradoxical breathing. No, just one of them.
Oh.
Flail. Good. So she said, I do see paradoxical breathing. Asymmetrical is pneumo, paradoxical is flail. So I do see paradoxical breathing. I felt crepitus on this side. There's instability, and I'm looking and there's paradoxical breathing. I'm going to quickly take a look. So observations, lift. I'm looking for shard, swelling, heat, altered function, redness, deformity, discoloration. I see altered function and a deformity. I don't see swelling, heat, redness, or discoloration. I'm going to auscultate, and I don't hear any abnormal breath sounds. Maybe crepitus. I know that it's a flail segment now. I'm going to get my assistant to come with a bulky dressing. Put compression on the flail segment. Can you hold it there? Thank you. Hold it there. And I'm going to finish off my rapid body scan. Anything else I find, I'm going to manage right away. Abdomen, expose the abdomen. Looking for DRT. I don't feel any pelvis. I don't see any deformities or fluids. Light push, light push, light push. I don't feel any instability or crepitus. Axial skeleton is done. That's your main part. I'm going to go into the leg, so femur. I might hide stuff. I don't feel any instability or crepitus. Lower leg. And medic alerts, and I don't see any medic alerts. If I find anything here like instability or crepitus, medic alert. If there is a problem, I'll check pulse motor sensation, but I'm going to skip that for now. Arms, same. No bony soft tissue or fluid abnormalities. No medic alerts in on this side. I'm done my rapid body scan. EMS is on the way. I can relax. I just finished my primary survey. Because she's unconscious, I can't ask history questions, so I automatically go into a secondary, not a focused, a secondary survey, starting with vitals. So heart rate, rhythm, and quality. Rate is rhythm, quality. Respiration rate, rhythm, quality. Eyes, skin, pulse ox, and blood pressure. My readings are, it's normal. So okay, so normal findings. Okay, so she would give me the numbers and rhythm and quality every time I get something. But if I report normal, she doesn't say anything, which tells me that it's just normal. It is what it is. My first set of vitals are done. I'm going to do another head to toe. As I do my head to toe, I'm going to do exactly the same thing I did before. When I get down to the feet, pulse motor sensation, level of consciousness as well. Hey, can you feel this? No response. Can you feel me touching? Can you push up against my hand? No response. The level of consciousness is still 0. Do it this side. Arm, arm. After my second head, during my second head to toe, I'm just going to reassess the flail and make sure I manage appropriately. After that head to toe, I'm going to reassess vitals again and do all my vitals until EMS arrives. Okay. Now, if EMS wants me to board, then I'll have to stabilize and board. So C becomes unsafe and so on and so forth. For the purposes of this, EMS arrives. Okay, so I just finished my second set of vitals, or halfway through my second set of vitals, EMS arrives. S-bar, so under handoff report, is patient and mechanism. I have a mid-20s female rugby player that I found unconscious. I don't know what happened. That's patient and that's mechanism. Problem 1, I found a flail segment and I'm applying compression with bulky dressings. Problem 2, suspected spinal. We're manually stabilizing. Okay. Sample, unable to get it. I didn't find any medical alerts. And these were my last set of vitals. Scenario is done. You can stop the computer. Okay.